Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is my May 2018 CEO Connection. I'm really pleased today to have Tammy Gavin with me to talk about our initiatives in telemedicine. Tammy's been at the hospital for, gosh, what,
31 years.
31 years, and has played pivotal roles in the leadership at the hospital. And as we decided to take on telemedicine, there just wasn't a better person here in our team that could head that up better than Tammy. So I'm really pleased to have Tammy with us today. And Tammy, why don't you talk a little bit about the telemedicine and what we got going there.
Okay. Well, you know, telemedicine is taking the country by storm. Everybody's advertising it and looking at it, and so we felt like it was a major initiative to help not only improve our volumes but secure our market share in the outlying areas and to enable us to reach out to other markets. And so we started by visiting the University of Mississippi Medical Center in Jackson, Mississippi back in January, and several of us went. And it was exciting to be there to see their operation because they're one of only 2 centers of excellence in the United States. So we've partnered with them. They'll be on site in the next few weeks to help us do a little bit better in organizing our strategy and our plan and our rollout. Our other partner has been the University of Arkansas for Medical Sciences. Several years ago they got a grant that allowed them to put telemedicine equipment out in all of our clinics. And so we've not really known how to use that or incorporate it into patient care, and with their assistance in UMMC we're now in the process of doing that. We've already started behavioral health, been participating with behavioral health telemedicine since March 1st, had several visits, that's gone very well. It protects patients' privacy because they can go to their primary care doc and see the behavioral health counselor. We're working with UAMS to provide neurology services at Newport. We've had 2 clinic days there and that's gone very well. We relocated that into the cardiac rehab area, so we're partnering. And then we're working with Dr. Angel on doing a pilot project for post-op orthopedics. So we're moving fairly quickly into an area that we hope can continue expanding with other services.
Well, you know, when you get into a rural state like Arkansas and you don't have real dense populations, and particularly White River Health System, when we have all the different rural health clinics and satellite clinics in and around the north central area, you know, telemedicine has a real great application for improving people's access to care.
It does, and cost effectiveness too, because we were looking at a clinic in Hardy for osteoporosis. Those patients need about a 3-minute follow-up. Well, to drive from Hardy to Batesville to have that done is really impractical, and we think we'll have better compliance if we do it close to their hometown. And so they can improve their care, save some money, but still see the specialist that they need to see.
Well, you know, the General Assembly last year in Arkansas, they really paved the way from a reimbursement perspective for telemedicine in Arkansas. And you know, when we visited the University of Mississippi Medical Center, I was really impressed to learn that they are currently located by telemedicine in 68 of the 82 counties in Mississippi. So, and with remarkable success, well, heck, they've been doing it for 18 years.
Yes.
And so we can really benefit from their trial and error, and so that as we implement, we can, you know, do that with confidence that it'll work well for us.
Yes, and they're good at identifying barriers and successes.
Sure.
And so I think even from a reimbursement standpoint, they'll be able to help us navigate some of those new rules, because there are some specific rules for different payers, and they'll help us be able to do that, I think.
You know, what's really impressed me is I've seen the equipment in action, and how far that's come along in terms of clarity of the visuals. It's really it's top drawer interaction between providers and patients.
It sure is, and if you look at the equipment and you do a demonstration, as we've seen, it can see a lot better than the naked eye.
Oh yeah.
Identifying parts of a dollar bill that you just don't see with the naked eye. So if you're doing dermatology, looking at skin issues, then you can see that clearly.
You bet, you bet. Well, I'm so glad that we're taking the steps we are right now, but I'm convinced, I think as you are, that we're going to see a lot more, hear a lot more about telemedicine in the years to come, so I'm pleased that we're taking this initial steps to get it going, and I appreciate your work there.
Thank you. We're excited to do it.
Thanks. I've got 2 employees of the month that I want to recognize again for May. At Stone County Medical Center, we have Bart Crimes, who's a respiratory therapist at Stone County Medical Center. He's been employed for just about a year, and so already he's been noted for being willing to help in all areas of the hospital. So I appreciate Bart being aboard and the initial immediate impact he's made at Stone County Medical Center. At White River Medical Center, I'm pleased to announce that Laverne Treadway from Environmental Services has been selected for Environmental Focus standard for the month of May. Laverne has been with us for about 6 years, and I think all of us can appreciate the hard work she does in making the facility more presentable. In May, we have 2 national weeks that we'll all be celebrating. Interestingly, May 6th through May 12th is National Nurses Week, and in addition, it's also National Hospital Week. So we've got 2 things to celebrate that one week in May. We'll be having some celebration on picnic and gifts and stuff like that during that week, and so in the next few weeks, announcements will be made and where to go and what to receive, and so come and celebrate with us those 2 very important National Hospital Weeks. May is National Melanoma Skin Cancer Month and Mental Health Month. It's important that we recognize different months of the year for different disease entities, and so during this month, let's focus in on good skin cancer health as well as increase emphasis on our mental health well-being. In terms of expansion of services, I'm pleased to report that cardiac rehab is now available at the White River Medical Center Medical Complex at Cherokee Village. We continue to expand the services to the people in the North Sharp County area, and I'm really convinced that cardiac rehab will do great, so people won't have to travel distances for that very important service. So we'll look forward to how that progresses in months to come. Each year, the White River Health System Foundation has an annual golf classic. This year it will be our 24th annual, and it will be held June 16th at the course at Eagle Mountain. As usual, we need volunteers to pull off this great event. It's one of our major fundraisers each year for the foundation, and so if any employees have time that day of June 16th and are willing to come out and give us a hand, boy, we would really appreciate you doing that. So we'll look forward to seeing you all on June 16th at the Golf Classic. Last several months I've been talking about operational assessment that's been performed by outside consultants, the Berkeley Research Group. They've concluded their operational assessment, and presentation was made to the White River Health System Board at its annual retreat at the end of March. Interestingly, they found some great opportunities for us in improving our revenues and ways to also decrease our costs, and we're right now in the process of taking those recommendations and determining which ones should be implemented and which ones we should receive assistance in their implementation. So more to come in the future, but the good news is there's some really good opportunities to do better at the facility. On the other side, however, I might say to you is that based upon their engagements at other hospitals, ours is very well run. So in one sense, I'm really pleased on how well we've done in the past, but I'm also pleased that there's still significant areas of improvement. So all these are critical to the hospital's desire to remain independent going forward and keep financially viable. So as I said, more to come. May marks the important month for many of our parents that their kids are graduating from high schools. During this month, we should remember all of them and congratulate the kids that are graduating from local schools and wish them the best in furthering their education. That concludes my May CEO Connection. As in the past, if you have any suggestions on how it can be more meaningful to you, please let us know. So thanks a lot and have a great month.